Hey guys, just have a quick video for you here, just a high yield radiology review for residents or anyone that might be studying radiology, maybe for an exam of some sort, or just day to day. I think radiology and the ability to read images is a very amazing privilege and skill, and I enjoy sharing that with anyone who is interested in learning. So basically, let's say you're taking an exam and you're presented with a single image that you see here, and you might be posed with a question that might be something along the lines of what is the best explanation for the finding shown here? And I'll just kind of give everyone a minute to look at it, and pause the video if you want. You can do whatever you want. And just to kind of get into it here, so we have a lateral scout radiograph of the brain. This is an image that's obtained with a lower dose X-ray before a CT scan is done, and this is to give the technologist an idea of the range of how far to scan from the superior margin to the inferior margin before initiating the CT examination. And so on the scout image, we see this sort of device that's overlying here, that's catching my eye, and then it looks kind of busy up here in terms of density and lucencies, a little hard to make sense of. And I see this kind of tube going down this way. It's above the oral cavity, so it's some sort of nasogastric or maybe even a nasal intubation tube. But anyway, we'll focus on the intracranial abnormality. So this device here, whenever I look at radiographs, I always start with devices. I think it gives me a good overview of not just sort of a pattern of where to start when I'm beginning my search, but it also can kind of give you a lay of the land for perhaps how sick the patient is or what's going on. If they have 10 different lines and tubes and an aortic balloon pump, then it's a very different context than someone without anything. And so basically, this device here looks like a frontal approach ventriculostomy device, perhaps a pressure monitor, a little bit hard to tell from a single image, terminating in the area of, I think would be the lateral ventricle, but again, hard to tell. Here we see these sort of oval-shaped lucencies adjacent to there. And then as I look more anteriorly, sort of towards the nose of the patient, I see these curvilinear lucencies as well, which appear to be more lucent than I would expect for frontal sinus aeration or anything within the osseous sort of diploic space between the anterior and posterior table of the frontal bone. So how do I bring this all together? There's a finding of pneumocephalus and gas within the ventricles, which is something that we certainly have to explain. But in the context of an exam, the answer might just be related to instrumentation. So placement of this device could introduce gas into the cranial vault as well as the ventricles. And so it's not a very exciting or case report worthy case, but it's certainly something good to train your eye to look for is abnormal lucencies on something just like a scout radiograph. And that's sort of a takeaway for a certain type of exam that likes to make sure you really know what you're looking at, and including on different modalities. So that's it for now. Take care. I'll bring you guys some more of these types of videos if you're interested. Thanks a lot.